Secrets.
Good. Okay. Tonight, we're talking about the pelvis. Now, the pelvis, everybody has one. But what's more important, you're going to learn a lot of times that it's misdiagnosed. Okay, a lot of conditions are misdiagnosed. Now, okay, so when I'm talking about the pelvis, we got to keep it classy. Okay, try and find a G-rated pelvis. So you know what I did? I got the Statue of David from behind and the Statue of Venus de Milo from behind. Okay. So you could say it's not romantic. This is elegant. This is class. This is art. So when you look at this, pelvic dysfunctions, and this means that the actual seat, and we're going to go over anatomy and physiology so that you get it down pat, but sciatic nerve, pain when sitting, bladder control problems, bowel problems, leg pain, foot pain, knee pain, all of those can be mimicked by unstable pelvises. And it's from prolonged sitting. It's from standing can aggravate it, pregnancy, medications. But why? Why would pelvises be such a challenge today? And it's also super missed. When we look at it, we have to look at the two different types of pelvises, male and female. Now it's kind of cool. We used to say a female pelvis looks like a margarita glass. Okay, a margarita glass is like this, and a male pelvis looks like a martini. Okay, upside down. Yeah, well, when you're teaching anatomy and physiology as long as I did, you got to come up with mnemonics to make the class interesting. Otherwise, you're just looking at dead people. So, but when you look at this, I want you to appreciate the structure of it. Now, the big bone here on the outside edge, and that looks like one bone, it's not really one bone. This is actually three bones that fuses when you're a kid. You've got the ilium up here, you've got the pubis that comes across here, and you've got the sit bone or ischium here. Okay, now, and this is the ischial tuberosity. Now, what's interesting, when you sit on that hard butt, okay, that's what you're sitting on. Now, each of these bones, they fuse to form the innominate bone. Now, you know what innominate means? No name.
No name bone?
I know. You got to know the guy's naming it. We're just having a good time. They were probably drinking wine out of some goat skin bag, and they just said, I don't know. What do you want to call it? Okay, the innominate bone. But now look at this. We also have the sacrum here. Now, this is phenomenally important because this is the base of the entire spine. This is why the pelvis, deserves at least an hour talk. Now, when they were starting to do human dissections, they had to make sure that the soul wasn't in the body. So, and every doctor, okay, and I'm talking back a few hundred years, they realized that the spine was the seat of all life, because if the spine was injured, the entire body wouldn't work right. And they knew the base of the spine was the most important, so they found the only three-sided bone in the human body, Father, Son, Holy Ghost, and they called it the sacred bone. And they realized that sacrum was empty. So the soul obviously wasn't in the body when you died, so then we could go on and do human dissection. I know, interesting, isn't it? Now, when we look at the back, and I want you to appreciate that there's no muscle that crosses this joint in the back. Okay, now that means that it's only ligamentous, and that's why I put this one up here on the right, so you can see the massive number of ligaments that cross it. Now, this joint actually articulates. It can move, but it's supposed to be stable. Now, you can imagine if you're sitting a long period of time, that's going to open up that joint and cause it to destabilize. But the joint, the pelvis itself, is a perfect joint. It never wears out. On people with long-term low back problems, that means the back has been spasming or injured or pinched. It tightens up, so the area above and below have to move twice as much. Now, what's beyond frustrating, and this is what a lot of doctors forget, we've got muscles that run down either side of the spine, and they're called postural muscles. We have phasic muscles that we have conscious control over. Those are like arm and leg muscles. But these you don't have conscious control over. And when I teach scoliosis correction, we talk about how if the spine bends, or if there's a bend in the spine, that this muscle on the outside edge of the curve is going to tighten up. Why? Because a muscle contracts and it's trying to straighten up or realign the spine. Okay? I just talked with an ignorant doctor who said, oh yeah, this muscle's tight to pull it down. No, I'm sorry, you got to study a little bit more neurology. Okay, because muscles don't work that way. These muscles that run on either side of the spine, you don't have conscious control. They're changing under what's called proprioception, or your body's position in space. So the back half of this is only ligamentous up here. We're going to go over all the muscles that attach up here. Now, have you ever heard of a tailbone? Okay, good. We don't have one. We never had a tailbone. Okay, I get patients in that their medical doctor has told them they have a tailbone. We never had a tail. We don't have tails. Okay, what we do have, we've got a coccyx down here. Now the coccyx, it's 4 bones that fuse, and it's on a really tough ligament, but you can see what it looks like. Like when you're looking at this, it's almost like a basket. Okay, and that's what I want you to get the idea of. So this basket has got this little coccyx that floats in there to give stability to the pelvic floor. And the pelvic floor is a group of muscles that's in there. And there's a lot of things going on with the pelvic floor. But when you look at the coccyx, how it comes into that pelvic floor there, okay, you can imagine that it's adding or giving some stability to the pelvic muscles. Okay, does that make sense? Now, so we've got these 3 bones coming together. We've got the pubis, the ischial tube, and the ilium. And that's called the innominate bone. What does innominate mean in Latin? No name. I know. There's an innominate artery, there's an innominate nerve. I mean, it's kind of cool. You got to know they had a good sense of humor. But these 2 pubis bones come together right here. Now, this is super important because this is a rare subluxation. It can actually have a problem. And this is super missed all the time. And so if this bone is out of place, if that pubis is subluxated, it causes intense pain. Now, when we're talking adjustments, remember, do you have a tailbone? No, we never had a tail. We never did have. Honest to goodness, I had one patient. He was actually the son of a patient. He had to get his appendix out for some crazy reason. And he asked the doctor that was removing the appendix, and they said, yeah, the appendix was back when we had tails. And I'm going, wait a second, the appendix isn't part of the intestinal tract. I don't know of any animal that has an intestinal tract in their tail. Okay, so this guy was just obviously doing drugs that he's passing out. So when we look at the coccyx, because you don't have a tailbone, the coccyx is there to provide stabilization. Okay. Now, also, when we're looking at the sacrum, which is the base of everything. So there's no muscle that crosses the back half of this joint. There's a couple of muscles or one muscle that crosses the front part, but it's mainly a structure that's supposed to be stable forever. Okay? And now, since we know, okay, which one looks like an upside-down margarita glass?
The female.
Women, yes. Why? Because that head's going to come through there. Men aren't going to give birth. Okay, the species would stop. Women are a lot tougher. So what does this pelvis look like? Now, does it look like a martini glass? Yes. So you could say male pelvis. I know, isn't that cool? It's like, you know when you see those forensic shows and they say, yes, it was a female pelvis. Now you know how they're identifying it. I know, isn't that cool? Okay, so now when we look at this is super important. There's a muscle, and this is one of the biggest challenges that people will have, because when they go to people that have studied health, okay, they forget to appreciate the body. See, as any chiropractor or physical therapist or medical doctor or physician's assistant, anybody, you're studied with anatomy and physiology just for a very short portion of your school. And you forget that the muscles don't react on their own. How many people have ever heard, oh, I have tight hip flexors? Yeah. That's impossible. Muscles don't react on their own. And I know this is a challenge because a lot of people that work on muscles, and they'll say, wait, no, that can't be because this person worked on my hip flexor and worked on it and it feels so much better. Well, why is it tight? Muscles don't react on their own. What's causing that muscle to increase in tone? And this is the most important hip flexor. It's called the psoas. No, not the psoas. Okay, it's up here. I couldn't resist. Okay, so this muscle, it attaches on the front of the spine. and it comes down. So now think of this. If its origin, if it originates on the front, and this is where all the organ systems are, and the psoas comes up here, and it comes down to the leg to actually have the leg flex. What if you have a sedentary lifestyle that's going to shorten it or keep it short for a long time? What if you have some type of pinched nerve up here or an alteration in that spine? Is that going to increase the tone of that? I know. Wait a second. I just saw like 4 or 5 light bulbs go on. Okay. Oh, so wait a second. So we got to do it a little bit further. We got to do a little bit more investigation to find out why that muscle's tight. Does that make more sense? Yes or yes? Good. I know. I'm going to give the choice there. So anytime somebody says, yeah, you know, you got chronic tight glutes, you got chronic tight flexors, why? Ask that. And keep asking why, because if somebody says you have high cholesterol, why? You have high blood pressure. Really, doc, what's wrong? What's broken? You know, and so when we look at this, we can see certain type of lifestyles, such as office workers, you can see, of course, that flexor is going to be short. And some of the stretches out that we're going to do is lunges to stretch it. But even then, I don't want you to stretch the hip flexor. I don't want you to shorten it. I want you to find out why it's tight. Does that make more sense? I know. So it requires a little bit more investigation. Now, when we look at bowel and bladder control, because we're talking about the health of the pelvis, and the pelvis isn't just the bones. Okay, all the bones are really cool. It's not just the sacred bone, which is the base of the spine that used to hold the case of the soul. Okay, I want you to remember that, because isn't that cool? Okay, and this joint has no muscle that crosses the back half of it, so it's a perfect joint. It only wears out if there's long-term low back problems. Okay, so that's essential to know this, but also, too, we've got bowel and bladder issues coming out. So the nerves, these nerves that come from the brain down to control every function of the body, they actually control the bowel and the bladder and everything else. So if you have bowel and bladder problems, you've got to start looking at this. Well, I know when we were teaching about the neck and the breathing, C3, C4, C5 keeps you alive because that's a nerve to the diaphragm. This is why neck problems can lead to breathing issues. S2, 3, 4 keeps the poop off the floor. S2, 3, 4 keeps the poop off the floor. Now how this is, we've got the cervical spine up here, we've got the thoracic spine here, we've got the lumbar spine here, we've got the sacral spine here. And that's what the S stands for. So S2, 3, and 4 are these, you know, the top nerves coming out. And that supplies the pelvic floor. So does that mean if you have an unstable pelvis that perhaps bowel and bladder issues? That means perhaps some other types of dysfunction. Now when we're treating incontinence or enuresis, bedwetting at night, you have to look at that. You have to look at that. But we also got to look at the other musculature around it too. Now we have it's gluteus maximus, okay, and that just means big butt muscle, okay. Now it comes around here and attaches on this ridge, but it doesn't cross this joint. It also attaches on the base part of the sacrum, okay, the sacred bone, that only 3-sided bone, and then it comes around here and attaches to the leg. So when you start looking at this, have you ever heard of a TFL problem or a chronic tensor fasciolata problem? Okay, and that's really common. What happens is this big glute muscle comes around and attaches to a big band of tissue. And this tissue, if you ever get a chance to see a dissection, it's the neatest thing ever. It comes down the side and it's thin, but it's as strong as shoe leather. You can actually lift the entire body up by this. Now, this band goes down past the knee. And this is what's really cool when you're doing some good diagnostics. And by diagnostics, I don't mean categorizing symptoms and lumping people into categories, okay, the way modern diagnostics are thought of. I mean actually finding out why the body's giving symptoms. Okay? Does that make more sense? So this little muscle up here, called the tensor fasciolata, okay, so what do you think it does? It tenses this fascia on the lateral side. So what's neat is muscles pretty much are going to tell you where their location is or what they do. So all this little muscle does up here is it tightens up this big band of tissue. Now this band of tissue goes on the other side of the knee. So if this muscle is tight, you're generally not going to feel it up here. You're going to feel it in the knee. So now could knee problems be the result of an unstable pelvis? Ah, I know. Isn't this cool? I know. So you got to start, it takes a little bit more diagnostics. Now, piriformis syndrome. This is probably the most overdiagnosed condition ever. Okay, now there's a muscle that goes across on the front of this pelvis. So this is on the inside. It comes across the front of that sacrum area out here and attaches to the leg. Now that's the piriformis. Now the piriformis is a hip, it turns the hip inside and out, it's a hip rotator. But when you look at it, this big old huge yellow thing coming down beneath that is called the sciatic nerve. Now the sciatic nerve comes out of the low back and the sacrum area. Now you've got this muscle right on top of that. So what happens a lot of times is that muscle will be tight. Okay, and it could pinch a little bit of the sciatic nerve. And so you're not going to feel it up here, you're going to feel it where that nerve supplies. Now the sciatic nerve is about the diameter of your finger, your index finger. It's about this long, and it runs all the way to the bottom of the foot, but it's about this long that runs down the back of the leg. And it feels just like a thick telephone cord, almost like an extension cord. You can't squish it like you would think a squishy nerve would be. It's so loaded with myelin. And again, you can actually pick the body up with this to see how strong it is. But you don't feel it. If it's pinched up here, you're going to feel it down the back of the leg. So a lot of times people with unstable pelvises, remember, that little piriformis muscle is just about the only muscle you got crossing this joint. So if that joint's unstable, is that going to increase the tone of that piriformis? Yes or yes? Yeah. So you get these people with unstable pelvis and they're saying, oh, it's piriformis syndrome. You just used it too much. Really? How did I use it too much? Ah, yoga class and walked. Well, yeah, but I walked the same on this leg as I did on this leg. Why is this one messing up? Okay, so I want you to start questioning people because they're not appreciating that the body's intelligent. Okay, now there's some rare conditions where the sciatic nerve is going to grow actually through the piriformis. That's a surgery, but that's really, really rare. But this, it's almost never the problem because it's usually the unstable pelvis. Okay, does that make sense? Now, and this is what's called dermatomal pattern. It's an area of skin supplied by a specific nerve root. And when we're looking at the pelvis, a lot of people will say, yeah, doc, I got this pain that comes right around here. And I go, oh, okay, thoracolumbar junction, that's the junction of the rib cage and low back. I know exactly where that is. Gosh, I got this pain that comes right down here. Oh, 6th cervical nerve root, no problem, we can fix that. That's pretty quick. Or what if you have somebody that has a numbness and tingling? Okay, in the area like where a bicycle seat is. I mean, a really good friend of mine just took up bike riding this past weekend, okay? And so I got her a seat that would actually fit because I don't want that area numb. Okay, I mean, because that's scary there. Now, here, when we look at the organ systems of the pelvis, now this is super important. This is a male and female pelvis on either side. But remember, when we're looking at this, this is a pelvic floor. Okay, it's just like a cup almost. Okay, a big cup. But in this cup area here, you've got muscles and you've got organ systems and you've got nerves coming out. So this is actually one of the most vital areas. And when have you heard that prostate cancer and prostate issues are on the rise? Yes. Hugely. Because if the pelvis is unstable, that's going to open up that pelvic floor. Opening up that pelvic floor is going to decrease the nerve supply and blood supply to the female organs, to the prostate, to the bowel, the bladder. So does that mean prostate issues, bowel issues, bladder issues, all from an unstable pelvis, possibly? Or from toxic blood, possibly? Just know that there's a problem. I mean, we're talking 80% of American males are going to have a prostate issue. And countries that don't have the Puritan roots that we have actually practice on a regular basis prostate massages. And it's just, you know, no, I'll massage your elbow, but I won't massage your wrist. Wait, no, that doesn't make any sense, does it? So this is something that actually is required for men for health. And you can see on the male and female pelvis, they both have a hole on the back, that's the rectum. Both have a hole in the front, although the male portion is surrounded by a penis. And this one, to get to the prostate, it's just a finger going in there. And I encourage people to eliminate. I mean, if you're married, save your husband's prostate, okay? Occasional prostate massages are going to be vital. It's kind of nice for the women's area, too. Just about the same location up, but in the different hole, and the hole in the front, that's where the G-spot is for women. So you could be reciprocal.
So prostates too?
Prostates nourish and add more fluid to the sperm. But so if you're not wanting to get pregnant, you still need a healthy organ. You can't have an organ that's static. This is why a lot of people with that are long distance bike riders, where they have those small bikes, they're going to have prostate issues, or can have prostate issues at a greater rate. People have sedentary lifestyles, truck drivers, office workers. All of those are going to have the prostate where it's compressing the nerves and it's compressing the blood supply. Same thing with women. This is where a lot of dysfunctions occur in women if they're sedentary lifestyles or office workers. Now, bladder issues. Again, the bladder is also at the base, located right behind the pubis here. Now, has anyone ever said, "Oh, I really got to go"? Okay, where you didn't have to go, and then all of a sudden you really had to go. Okay, well, what happens is, and this happens in enuresis or bedwetting, it happens in people with incontinence. You don't have pain sensors in the bladder. I know. Nope, that's not true. My bladder was killing me when I had to go. Okay, no, those are pressure sensors. Okay, they're pressure sensors. So what happens is that bladder usually is empty, and then it can grow up to hold a pint, maybe a little bit more. And so as it goes, you should be getting little signals coming up from that bladder up to the brain. And these little signals, all of a sudden it's saying about half full, three-quarters full, man, it's really full, you got to go. In kids or in adults that have bedwetting, sometimes that communication from the bladder up to the brain is impinged. It could be impinged up here, it could be impinged here, it could be impinged here, but that bladder has to massively increase its sensory input in order for the brain to hear it, so then all of a sudden, oh, I got to go. Okay. Or that sensors inside of the bladder is malfunctioning. Where you feel like you really got to go, and then you go to the restroom and there's like a little tinkle. And you go, that was hardly worth me walking back here. Okay, then you go out and then, oh gosh, another 10 minutes. So I'm going to show you, so if you're urinating about 1 to 2 cups per time, if it's about every 3 to 4 hours, that means you're hydrated enough. If the urine is almost clear, you're hydrated enough. That's fantastic. Now, to reset the sensors, like let's say you have a problem of frequency, you can do a kegel to reset the sensors. So if you think that bladder is tight, you can do a kegel. And what a kegel is imagine if you're urinating and you stop the stream midstream. Okay? So who wants to do a kegel with me? No, everybody's going to do a kegel. Okay. 1, 2, 3, kegel. Hold it. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, relax. Okay, you're going to do that on a regular basis. I know it's fun to kegel together. Okay, but the solution to this, you got to get the pelvis checked. Because if the nerves in the low back or the pelvis is unstable, the bladder's not going to function correctly. And you got to get the low back checked. And when you look at this, the incontinence, why is it so rampant? You don't see Aboriginal cultures where people bend, turn, and twist that have incontinence. It's just not there because they're always moving the pelvis. In sedentary lifestyle cultures where you're sitting on this ischial tube, that butt bone, and you have a toxic deficient lifestyle, you're destabilizing this pelvis and those nerves are getting compromised. And what's worse is the body, if you have compromised blood supply here, what do you think is going to happen to the body? Do you think that if you have compromised blood supply, if I go in and I shut off blood supply to my arm, what's my body going to do to my blood pressure? It's going to increase it, to get by that blockage. Okay, if I've got some kind of blockage anywhere else in the body, it's going to increase it. So if you've been misdiagnosed with high blood pressure, you got to start looking, wow, misdiagnosed. I wonder if my arteries are clogged. I wonder if there's some type of blockage somewhere. And now here, this is the Kegel exercise. Remember, we're talking about the pelvic floor. And the pelvic floor is just this opening here. And now, can I borrow your arm for a minute? Okay, good. Now, this right here, what I'm going to do is stretch the muscles in this arm. Okay, I'm going to stretch it. Okay, now try and bend your arm. Can't do it. Okay, because these muscle fibers, they're stretched to just like the end result. Okay, and that means there's not a lot of strength. Okay, now I'm going to shorten the muscle fibers. Okay, now bend your arm. Okay, thanks. You must be Irish. Okay, yes. Good, I was just beat up by a gal. Okay. Okay, well, you saw how strong she is, but that's because we shortened the fibers. So think of this. If that pelvic floor is open and stretched because of chronic pressure pushing down, like all the organ systems are pushing down, unstable pelvis, the nerve supply to those pelvic floor muscles. So all of that is going to stretch that open. So what's going to happen? You're going to lose control of it. But not just control of the bowel and bladder function, also control of the romance organs too. In male-female relationships, that's really important. And that should be going on at every age throughout your life. And so when you look at this, the male and female kegels, not only is this something that men and women need to do, but it increases the PONR, okay, for men. Point of no return. Okay, now, gentlemen, 2 women asked that. Okay, just check it. Okay, but what happens is it gives you more control. Okay, and it's just in what I want, because our society, we're taught not to think about that area, don't talk about it. But if I never work out my bicep, it's not going to be strong. If I work it out all the time, it's going to be strong, right? If you don't pay attention to a relationship, is it going to be strong or weak? Weak. So good relationship, you got to pay attention. If you want to pay attention to this area, guess what's going to happen? You're going to get better. Yeah, and so we're talking about it improves control, improves sensation. Just by flexing that muscle, it's going to improve blood supply to it. And then if that pelvis is stabilized, everything else works better. And how you do it, you tighten it up, hold for 5 seconds, and do 10 of those in a row about 5 times a day. And you can do it at your office, driving. It's just one of the essential things that you do. Now, if the pelvis is unstable, and this is something that I teach at seminars, I mean literally in other countries, this country, all over, how to check for pelvis instability. In our office, all you got to do is approximate the hips. And this is when someone's laying down. And this is somebody laying down, you're just approximating the hips. If that person says, ah, or that's a big difference, that means the pelvis is unstable. Okay, and so what we'll do is we'll use what's called a trochanter support. And this is the simplest belt ever. It's got 1 pull like that goes around it, and then 2 more to tighten it up even tighter. And this, you only need the trochanter support unless there's some kind of pathology, maximum for like 3-4 weeks. Because remember, there's no muscle that crosses the back half of this joint. So it takes very little effort to approximate it, have it stabilized, and then have the person walk or stand for several hours a day. And that's going to stabilize that joint. So it's a really easy joint to stabilize. But now let's say you're sitting all day long and you have an unstable pelvis. Best thing in the world is to sit like a cowboy, okay, where you have that chair backwards, you open your legs up and you sit down. And why? When you open the legs up, it brings them in, because these 2 holes here are for the legs. You bring those legs out, and it's just by those legs being out, it's going to approximate the hips, take the pressure off. No, I want to hear a wow. Yeah, you can sit down with an unstable pelvis. That's pretty cool. I know. I mean, otherwise you sit like this with your desk, and in some office settings that's not appropriate. Now this, I want to bring. Now this, I want to bring up a couple of case studies, because a lot of times when you're looking at the pelvis, because remember, we're talking about the nerve supply to this pelvic floor is going to cause pelvic insufficiency. But where does the nerve supply to the pelvic floor begin? Up here in the brain. So now here's a gal, came in, pelvic insufficiency, 82 years old, low back pain for 20 years, abdominal cancer, I think it was like 10 years ago. So I mean, she had a lot of issues. And you can see this is her standing up when she first came in. That's her 90 days after. And after 90 days, she developed bowel and bladder control. But now here's the tough part. And this is something I want to share with the doctors that are watching this. This is her low back. Now, I'm saying that the pelvic area can be affected by the low back. What I want you to see is 90 days. This is her low back. Her low back is horrible. Okay, we're talking a massive bend off to the side. This is the front view. This is her standing up. And this shows the spine. I don't even know if I could bend the spine that bad, but it's bent almost like that. Okay, and this is horrific. So when you look at this and you say, wow, abdominal cancer 10 years earlier, low back pain for 20 years, why do you think she had abdominal cancer? Do you think that the nerves in the low back were compromised to the abdominal area? Yeah, and that's the tough part because it's missed. Nobody says, wow, you got cancer because you've got a weakened immune system.
How do you miss that?
It's not even looked for. Medical doctors aren't going to look for a misaligned spine because they don't correct it. Heck, a good number of chiropractors aren't going to look for a misaligned spine as the source of cancer.
At a glance, I mean, that's not normal.
It's not normal, but if you can't fix it, you're not going to look for it. And that's the frustrating thing from my end, because when somebody says, oh, I had breast cancer, or I had skin cancer, or I had this cancer, I'm going, wow, that's got to be a defect of the kidneys and pancreas. It's got to be some kind of toxicity or deficiency. There's got to be some source of this, okay, because we want to find the source of it, correct it so this stuff doesn't come back. Well, what's interesting is there wasn't a great change. A 1 degree change in the low back, that's nothing in my world. Okay, at least it didn't get worse, but she got bowel and bladder control. Do you know what that's like to be 82 and be able to have bowel and bladder control? That's huge. You get your freedom back. You get your life back. I mean, you feel real, but I mean, this is a great shape change. And this is any doctor looking at this, when you're presented with a symptom of pelvic insufficiency, should you look at the whole body? Wow. That means we should pay attention to the whole body on symptoms. We should develop a term for this. What do you want to call it? Holistic. Oh, I like it. That'll catch on. Oh, I think that's a good idea. Okay, good. So now also too, since we were talking a couple of weeks ago about calves, okay, this is one of the best calf stretchers that we have. And all it is a block of wood. But what we do is, now, you'll see I put high heel shoes as good shoes. Gentlemen, good shoes?
Yes.
I see a lot of nods. Yes, yes. Ladies, do you like looking sexy with the nice shoes?
Yes.
Yes, except, I mean, I'm not except because every high heels are good. But what happens is, remember, this pelvis has no muscle that crosses the back half of it. So if you're walking with that, you're going to be moving the pelvis in such a fashion that you can destabilize it. But that's okay because you look good. Okay, so what you got to do, you got to know that you're going to sit with your legs out wide. Okay, you're going to do the calf stretch. Okay, you're going to walk at least a half hour a day without the high heels to stabilize the pelvis, and you could wear them. Honest to goodness, my mom wore high-heeled tennis shoes until what? She was 84. Yeah. Yeah, and I mean, she was a glamour girl from the 40s, so she would walk barefoot around the house on her tiptoes like this. She had probably no calf muscles left. Yeah. Now, also too, for sitting, let's say you don't have the advantage of sitting with a chair backwards. Okay. What you're going to do is put a rolled up towel or a foam piece right at the junction of the rib cage, which is up here in the low back. And what that does is it rocks the pelvis forward. It restores that curve in the low back, taking pressure off of the pelvis. And so this is for truck drivers, people that have to sit a lot. And we'll prescribe this a lot where we'll say, bring in a towel or a beach towel, bath towel. And it goes right at the bottom of the elbows is the bottom of the towel. And you could see sitting on a ball chair is going to be better. Now, why would sitting on a ball chair be better?
To relieve the pressure at the bottom?
Relieve the pressure, but also maintain motion. Because if you're sitting on this butt bone here on a stable surface, it's going to start to separate. If you're sitting on an unstable surface, you're just going to be moving it just a little bit, not much, not like this unless you're drinking heavy. Okay, but this is for demonstration purposes. Okay, and what that movement does is it keeps the joint healthy, it keeps the ligament healthy. Now, this is the absolute worst exercise in the world. I've had patients come in and they say, oh gosh, my physical therapist told me to pull my legs up. Now this will make the low back instantly feel better, instantly feel better. Okay, if you have back issues and you're like this, and say you lay on the kitchen floor, within about an hour you will not be able to stand up ever. You're going to call emergency. Now the low back is supposed to have a curve. Okay, now remember we're talking about the pelvis. So the holes where the nerves come out are on the back half. So when I flatten this out, and I want the front row to look at these holes here, when I flatten this out, what happens to those nerve holes? They open up. Yeah, isn't that cool? So since those nerves might be pinched because the discs are damaged or compressed, you sit down or flatten out the back, it opens up the nerve holes and feels better. However, when we look at the normal back configuration, and I put up somewhat normal lumbar spines up here, where it's narrow at the back where the disc is and wide at the front. What you're doing here, you're changing that shape of the disc, making it wide at the back, narrow at the front. So when you go to stand up from this, you're stuck in this position. If you're lucky, you can't stand up. So this is absolutely, absolutely, absolutely not recommended, particularly if you have an unstable pelvis. Completely not recommended. Never, ever, ever, ever. Like ever. Okay, now here, this is a phenomenal exercise. This is called a cobra exercise, because what will that do? And what we do is a modified cobra, where if you're going like that, if you're pushing the low back in that circumstance, you're creating a negative pressure on the front, and that's moving the disc material from the back up to the front. It's fantastic. This is restoring the lumbar curve, the exact opposite of what you're doing when you're sitting. And then, of course, using the ball chair is going to be essential for this. Now, when you're talking about the health of the pelvis and the health of the pelvic floor and the health of the muscles, you got to have healthy blood. Okay, just like when we're talking about healthy joints, so this means no polyunsaturated fats, you got to have regular juicing, you got to have clean, beautiful, healthy blood. I mean, this slide on the left, those are red blood cells that can hold oxygen, they can carry nutrients. The slide on the right is somebody taking fast food and dehydration. It's clumpy. In order to adapt to that toxic environment on the right, people are going to have to develop higher blood pressures. Does that make sense? Yeah, you're never going to have a healthy blood pressure or healthy blood flow unless you have healthy blood. And this right here, do you think the person, the heavy-set person, is going to have more pressure pushing down on those organ systems here? Yeah, and what's going to happen in that pelvic floor? It's going to be strained. It's going to be straining and opening up. That person's got to start doing kegels. They got to start stabilizing the pelvis. But what happens? All the nerves that come out of that on this person on the left, we're talking polycystic ovary syndrome. We're talking fibroid system because the blood supply and nerve supply is shut down. We're talking, bowel and bladder insufficiencies. I mean, forget sexual performance. I mean, she's not going to have any feeling down there. The nerves are going to be compromised. I mean, this is a horrible lifestyle. But she's going to go to so many doctors, and they're not going to look at pelvic problems. They're going to say, wow, you need a female Viagra. Wow, you need this blood pressure pill. Wow, you've got tissue damage. You need the cholesterol drug. I mean, that's why the pelvis is like the most missed around, when it should be appreciated that the bodies are supposed to function normally. These are some great exercises. This one is my favorite at the gym with the ball. But just as long as you're moving, movement is healthy. You never lay on your back and bone both your legs. But as long as you're moving that pelvis, moving everything, it's dynamic. This is fantastic. We have one of these jumpers in the back room. And this is like one of the best. And you can just do it right now. I'm actually doing it right now in front of you. Okay, but what am I doing? I'm increasing pressure by going up, so I'm increasing gravitational force loads. When I go down, I'm decreasing it. So I'm increasing and decreasing gravitational force loads. Is that increasing and decreasing pressure on my bones? Yeah, it is. Is it increasing and decreasing pressure on the discs? Yeah, so that means that there's going to be more fluid in my disc. There's more fluid in my discs. So it's just movement. That's all it is. It's just little tricks. This gal here, Chris, 48 years old, 7 years of hip pain. Okay, bladder problems, sexual dysfunction, everything else. She came in last week. I changed the name. But what's frustrating is she would say, Yeah, her husband actually brought her in, okay, and she said, I tried chiropractic before. I'd get adjusted. I'd walk to the car. By the time I got out of the car, my back would hurt. I know, okay. Some people in here, had the same experience at a chiropractor. Well, what happens is, if somebody is not taking an accurate assessment of the lumbar spine, if they're not finding out why the pelvis is a problem or why the pain is here, if they're just working on the muscle tissue, if I work on a muscle, tight muscle, will that feel good temporarily? Yeah. If I push till I hear a pop, okay, will that feel good temporarily? Yeah, we call those doctors pop and pray. Pop, pray, that one's right. Okay. No, I'm talking. This is what we're talking in the chiropractors that don't have corrective protocols where they're going to take an X-ray, take a post X-ray to document structural changes, and they're not looking at the entire body. I don't have a lot of respect for people like that. Okay, you got to have an end point in care. So, if you're assessing it, I don't adjust the pelvis a lot of times. I make sure it's stabilized. We'll put a trochanter support on it. We'll work on just the lumbar spine. But this gal here, 7 years she tried it because it would feel good just for an hour. After the first visit, her pain was 70% decreased. Why? Because we adjusted the lumbar and stabilized the pelvis. By the third week, the pain was gone. I mean, I move the bone, God does the healing. But the big thing is, you've got to have respect for the body. If you got respect for the body and the body's processes, it's really easy. I mean, I could teach you guys to say, hey, look, that spine's bent there. We're going to push it in that direction. Okay? This little white line means it's inflamed. So we know it's inflammation of the SI joint, so we know we got to stabilize it. Why is that off? I don't know. Should we take a picture of the chest area? Yes. Should we take a picture of the neck? Could a reverse curve in her neck also be contributing to this? Absolutely. Should we pay attention to her calf and her knees? Yeah. Could she have flat feet? Could she have bunions? I know. Isn't this cool? Sherlock Holmes has got nothing on us. This is like way cool. So this is actually what you require, okay, for healthy pelvis. Okay, you need to get your nervous system checked. And by nervous system checked, it's not check the site of the injury. That's foolish. It's disrespectful to the body. This thing is a brilliant design. Check the whole thing. What's it called again? Holistic. I like that term. Okay, so regular exercise. This means you got to move half hour every day minimum. Okay, but if you move more, that's better. You got to have proper nutrition. This means if man makes it, you don't eat it. Okay, so you have healthy. I mean, you could eat dirt occasionally, but you want to generally eat healthy. Sufficient rest. This means deep sleep every night with someone you love. I mean, deep sleep every night. Okay, with someone you at least like. Okay, and prayer and meditation. Okay, you gotta have prayer and meditation, because if you pray over your food, that's actually going to become you. Okay, if you identify with a power and energy source that's greater than you, no matter what your belief system is, your life is going to turn out better. Okay, it really will, and cell production increases, and that's just based in science. Now, all of these are on our website, and all of them are. Let me see, I don't have that one up there. All of them are available. The slides, everything are on Owner's Dash Guide. Okay, so I really encourage you to go on that website, share this with doctors, physical therapists, people that are lost, okay, so they can start looking and respecting the body. Okay, does that make sense? Okay, and next week, it's going to be wild. I couldn't come up with the name for it, but it's actually going to be, people walk around like programmed realities. They do the same thing every day, and they're going to get the same result. I'm going to show you how to become from a programmed reality to an observer of that reality, where you can change your reality. You can change your personal reality to change everything coming into your life. So, thank you very much.